we are not talking about special kids. We are talking about neurotypical kids.
They are called naughty, or they are called like they're aggressive with their peers, or they are distracted, they don't want to finish classwork.
Why is my child always distracted or throwing tantrums? हर एक parent ये सोचता है, but often brushes it off thinking they'll grow out of it. And we are exactly exploring this with expert Anisha Goel, who helps us understand misunderstood kids through occupational therapy.
What are some of the red flags which parents might overlook, but they are actually signs that the child might benefit from OT, occupational therapy?
So at home you would say simple like not listening, like you call their name and then they are just.
We have seen aggression in kids जो हम ignore कर देते हैं बोल के that it's bad behavior.
My husband thinks I'm overthinking. My in-laws think my child is so smart. Why would I need therapy?
Hi Anisha, welcome to the podcast.
Hi.
I am ready to dive straight into the conversation because I have so many questions, not as a podcaster but as a parent.
Absolutely.
Let's start with basics for me and the audience. What exactly is occupational therapy? And the second question is, how does occupational therapy help children?
So, occupational therapy helps with the occupation of the child. It can be from reading and writing, it can be from doing tasks every day, to playing, to getting ready, to anything that the child needs help with. And once we see that, if a school picks it up, or a parent picks it up saying if their emotions, they feel like their emotions are too big, consulting an occupational therapist is a great first step, and understanding the process of how occupational therapy can help the child.
But correct me if I'm wrong, generally occupational therapy को special needs के साथ associate किया जाता है. Is that assumption correct?
See, occupational therapy may be a lifelong thing for a special needs child who has a diagnosis of autism or a syndrome or something like that. But there is a whole spectrum of sensory processing disorder which we need to accept that today 1 in 7 children have it, and they are not going to need occupational therapy on a lifelong basis. And a little bit, say 6 months of occupational therapy, a year of therapy, is just life changing for the child.
So this, we are not talking about special kids.
No.
We are talking about neurotypical kids.
Absolutely.
Which I know is not the correct term, but just to get it down at a basic level, normal kids.
Absolutely. School going children, where, they are called naughty, or they are called like they're aggressive with their peers, or they are distracted, they don't want to finish classwork. All those children might have an underlying sensory system which is playing havoc for them, which needs a little bit of correction through occupational therapy, and then those children just blossom.
आपने थोड़े एग्जाम्पल्स दिए लाइक नॉटी और डजंट वांट टू पे अटेंशन इन क्लास. लेट्स डिग डीप. व्हाट आर सम ऑफ द रेड फ्लैग्स व्हिच पेरेंट्स माइट ओवरलुक बट they are actually signs that the child might benefit from OT, occupational therapy?
So at home you would say simple like not listening, like you call their name and then they are just too engrossed in a toy and don't want to interact, or they don't want to play on the beach, or they have they want very comfortable clothes, they don't want to wear Indian clothes, so they have a scratchy, the clothes are scratchy. Or say for instance, if they don't want to eat certain food types, all these things from a home environment can be a reason why they need occupational therapy. Of course, in a school environment, the demands are different. The school expects them to sit and to complete classwork, interact with peers in a certain way. So in all those situations, a school can ask for an occupational therapy evaluation.
Let's do one thing. Let's take few of these concerns of neurotypical kids. And आप हमको बताओ that why is this happening and how and which OT activity can help. The first one being, a lot of parents say that my child doesn't sit in one place or has issues with attention span. What's going on there?
So the thing is that every age group has an attention span, and there are certain tests that it's not that a 3-year-old and a 5-year-old is expected to do certain things, but of course there are certain norms which are expected in a classroom where a child has to. So it can be that their sensory system is not feeling balanced, and they are looking for movement. And while they are looking for movement just to calm their sensory system down, we as an outsider say that they don't want to pay attention, but they are just doing something that makes them feel better about themselves. It's like today, if you have a mosquito bite, you are going to scratch. And if I keep telling you don't scratch, the if feeling of wanting to itch the scratch is not going to go away. So while we understand that if today a teacher keeps telling a child, "Baitho, sit in one place," but if the sensory system and the body balance is not allowing the child to sit, the child is not going to listen to you.
So how does OT help in this? If someone comes with this issue, how do you all help him or her?
So them not sitting can be like for a various number of reasons. So we need to find first through an OT evaluation as what is causing it. Is it that they need a sense of movement all the time? Is it that their core is not stable and that's why they are flipping and flopping? Or is it that they are finding the task too challenging, where their fine motor is not developed enough? So we have to work on the fine motor, and that is a sense of avoiding the activity. Or is it a sense of like they are not able to scan the work? Like there are some people, like reading is a task that you have to go left to right, up to down, and maybe that task they are finding difficult. So that is a sense of avoidance. So once a child comes to us, we need to understand exactly why they are fidgety in school, why they are distracted, and based on that, each child's reason of why they are hyperactive or lack of focus can be completely different. What a occupational therapist will do is also completely different based on the child. That's why it's one-on-one, and the program that is designed is exactly what the child needs.
सो ऑक्यूपेशनल थेरेपी इतना इफेक्टिव हो सकता है दैट आपने बोला कि न्यूरोटिपिकल किड्स में इफ़ दे टेक फॉर 6-7 months it can really improvise the attention span or that fidgetiness?
Yes, absolutely. It takes about 6 months. In about 2-3 months, you see the difference. And in 6 months, like the change of the nervous system is permanent. So when parents come to me, my only request to them is that, if you've taken the step, and you've accepted that this will help your child, just go the long route and take that 6 months or 1 year, because that is something that once your system is rewired, it's rewired for good. It's not like once you have a sensory processing disorder that it's going to last all your life. Once your sensory system comes to optimum level, you don't need and your system just functions the way we should function.
So it's just a matter of 6 months to 1 year to rewire the nervous system.
Like I said, if there's a ADHD diagnosis or mild autism or severe autism, these conditions are different. But I'm talking like
they come under the spectrum of special needs.
Yes.
But here we are talking about neurotypical
Yes, absolutely.
kids. Yeah. Okay, now moving on to the other concern, जो हम बहुत casually बोल देते हैं, my child is a very picky eater. Some kids, they do not want to touch the texture of the food, or they just refuse food completely. So are they just being fussy, or there is a sensory issue?
So in some time, like of course in growth pattern of children, there is a point that okay, they might like certain foods and they might not like. But if you see like certain complete foods being avoided, food groups, like if you see they don't eat vegetables at all, or they don't eat fruits at all, or they have a problem having a vegetable mixed with a dal and rice. If you see certain like categories of ways of eating, the child is not eating, they only want to have dry food, or they don't like somebody might not like even a spilt dal piece on like on their body or on around their lips. Now those are signs which are not exactly you would say that the child is having difficulty, or they need only screen time to finish their meal. So somewhere we are suppressing the sensory system of the mind and the body by giving them screen time. So if we feel that there are certain foods that they are only eating with screen time, and then without screen time they are not even willing to see it or touch it, that might be a picky eater for you.
Exactly is the neurological issue when it comes to picky eater? If you can just explain it in a simplified term.
So once again, it's got to do with the sensory system. So sensory system, we have 5 senses that we are aware of, and 3 others where we work on balance, motion, and our internal senses. So if any of those senses, again, it comes to the sensory processing. So there are certain picky eaters who cannot stand the sight of vegetables, or there are certain people who can stand, the children who can stand the sight of it but can't stand the touch of it. Now which exact sense of which child is not accepting the food, which is not letting them eat the food, is what we need to understand, and then we need to try and help them.
Interesting. Now, moving on to aggression. We have seen aggression in kids जो हम ignore कर देते हैं बोल के that it's bad behavior. How can one differentiate between actual aggression in kids that might require help versus bad behavior जो eventually ठीक हो जाएगा?
So aggression and the emotion only comes when your body is not feeling as balanced, or you don't know how to deal with the situation. Your words are not coming out. Again, it can be an underlying stimulant of a sensory system imbalance. If you see your child facing aggression in regular cases, like if you see, for instance, like once a month they've been told that they'll get a treat and they don't get it, and because of that they're upset, that's pretty normal. But if you see in their day-to-day activity, which a normal child should not feel aggressive or should not feel overwhelmed, at that situation if you see that the child's emotions are not what an age appropriate child would react in, there can be an underlying sensory reason, and at that time you can question an occupational therapist or go and meet someone to get an opinion as to why he has bigger emotions than a peer of his age.
Why don't you take us through like a typical OT session? What happens when a parent comes to you?
So it all depends. We have like a formal testing which we do for children above the age of 3 years, which is called the BOT. And they first test the gross motor skills, they test balance, they test coordination, they test like eye-hand coordination. There are also certain like say manipulatives that they have to work with, say a coin, or but everything is done in a play-based way where the child feels that they are playing with the therapist. The therapist is not wearing any clinical setup in our, and for a reason, right? The minute you wear a scrub or something, they start understanding that this is some kind of medical clinical setup. So from my perspective, I have kept it like they're coming to meet like an auntie or a teacher who plays with them, and then we have certain activities, and once we have a parent interaction form where we see if there were any concerns, prenatal or post-delivery concerns that the parent might have had, which could have led to this situation. And then once we analyze the data, which these tests help us analyze, we then present it to the parent and suggest if the child needs occupational therapy, if they don't need it, how many times they need it, and what type of therapy. Do they need only one-on-one, or do they need, if there's certain social skills the child is lacking, they need social skills as well.
And what is the correct age to start OT?
So there's no correct age, like I said, there's always neurodiverse and neurotypical. There are some children, unfortunately, who start very early, even at the age of 6 months, they've gone through therapy. But certainly by age of 2 and 3, you might be seeing certain signs at home, like they are not able to eat independently, age appropriate puzzles are not being done, or maybe you feel like they keep falling, or they keep bumping into things, they keep looking for support, and or they are very they need a lot of hugs and a lot of deep pressure to go to sleep, or they may take too long to go to sleep, where the neurosystem like needs a lot more time to settle down. These can be the subtle signs, and I always feel like the mother's instincts are really something that one, nobody knows their child but better than a mother. So I feel like as a family, goes to the dads and the grandparents. Please support the mother. When we have a lot of mothers coming to us and says, my husband thinks I'm overthinking, my in-laws think my child is so smart, why would I need therapy? But I realize that I also face these difficulties as a child, and now I can relate to my child because I see my child going through the same. So as a family, I would say like occupational therapy is, now if we see the ratio of how many children need it, I think we should be open-minded. Go in for setups where you are comfortable, your child feels comfortable, your questions are answered, and please take the plunge, because you're making a change, you're giving our current children a better future.
Absolutely, I couldn't agree more. So I asked you that at what age we can start, but is there an age till where we can take the occupational therapy and beyond that it's not going to
No,
work?
it's not like that. I would say early intervention is better, because the neuron system, like we all know, is the best till the age of 6. The children learn the fastest, and their brain is growing at the fastest speed. After that, it slows down, as we are all aware of it. But it doesn't mean that the correction can't be done.
So if a child is, for example, 8 years, 9 years, and that's when the parents figure out, oh, OT is required. So even at that age, it can be beneficial?
Absolutely, because then the academic pressure shows you that, so there might have been underlying reasons over the years that one has missed. But at 8 and 9, when the school pressure tells, when the schoolwork is not being completed, or they don't want to, the teacher starts saying they are fidgety and they just don't want to, and then they feel lack of confidence or with their peers. So yes, please go ahead and, schools are also very supportive nowadays, are very proactive. So once again, my request to parents that please accept it. The schools are not here. We do put our children into IB schools for smaller environments. We are giving it so that they get the care. So once there is something noticed in that environment, let's all respect it and do the little correction, because that's only helping the child. Like occupational therapy is one thing that cannot harm anybody. I wish it was a subject in every school.
You think OT should be a
Yes,
subject in school?
absolutely. Why not? Because it only benefits every child. It has no harm can be done to the child with occupational therapy, and especially boys. We all see, I think,
Why boys especially?
girl moms and boy moms. I think we all know.
Yes, I have a daughter and a son, and I see the difference. But why particularly you're saying that boys should be
See,
more prone to OT?
I can't tell you the stats, and I can't tell you, but definitely as the owner of Power Learning, I can tell you 85% of our children are boys out of 100%.
And why
So
is that?
I
Just the way they are designed?
I guess it's in their DNA. So I would say like every boy can go through occupational therapy and it'll only benefit. And that's also their playfulness and everything. But in the long run, of course, when the academic focus and everything come, we see the girls are able to color longer, the girls are able to, just how we see normal children growing up. I mean, we'll see a different side of boys.
But I've had this conversation with someone, and they said that girls have a different DNA, and boys are, they are different when it comes to learning. Now क्या होता है एक स्कूल में we expect that all of them learn in the same environment, which cannot be the case because, like you said, like boys like much more of a movement and energetic activities, while girls are okay sitting down paying attention. So I've had this conversation with someone, and now it's like just coming together. In our conversation earlier before the podcast started, you were saying as parents we have gone through something in our childhood, and our kids are going through it right now, and then we realize, oh, this is something which requires help. Is OT for adults as well?
I think as we grow up, like we learn to mask our sensory systems down. And let's be honest, as a grown up today, how many things that you don't like to do are you being told to do? You're not being forced to study a subject that you're not liking, or I'm not telling you to be a doctor when you're a podcaster or a mom blogger, right? So the thing is, obviously, as a child, the amount of demand we put on a child is to do everything, whether they like it or whether they don't like it. That's how our school curriculum is based. You like history, you don't like history, or you don't like a language, or you like language, or you don't like art, you're still expected to do it. So when that kind of pressure is put in onto a child, we do see more kind of play on the sensory system. And of course they are still kids, they don't know how to regulate their emotions or to deal with that kind of pressure.
So till now we have spoken about how children need occupational therapy and how it can help them. Now let's come to parents. Certain parents may delay seeking help, thinking that they'll grow out of it. What would you tell the parents out there?
So they don't really grow out of it. The problem might become bigger. For instance, today a child is hyperactive at 2 and 3, and at age 2 and 3, what is the academic pressure, right? There is no academic pressure, so the child is still able to do it. Versus when you come in at 6 and 8, the kind of academic pressure that a school puts, or the kind of reading that is expected, or independent work, when the child is not able to do it, they start questioning their intelligence. And then that works on the self-esteem of the child. And then nowadays kids are so smart, because in a class of 15 everybody knows who finishes their work, who doesn't, who needs a little more teacher help. And then that is, say the peers will be like, oh, you're just so slow at your work, oh, why don't you study a little at home? Why? And that again works at the self-esteem. So if there is any way you realize, and if any kind of preschool or any other school or your playgroup or the early years of your regular schools have pointed out that there might be a red flag, I would say, when there is no pressure of academic pressure coming onto the child, let's just go through the process and correct it so they don't face that problem going forward.
But tell me, is there still shame or guilt attached to therapy?
Yes, there is. And that's why I named it the Power Learning Center. Instead of not having therapy on the thing, on the nameplate, when you come in. Also making the environment very welcoming. So it's not clinical. You come in saying it's a soft play area, or like a nursery or something, some environment like that you're coming in. So no parent loves coming into my space, and I need to understand that emotion, that considering they don't want to come, I need to be helping them feeling as welcomed as they can in the space, for the child and for the parent. For a younger child, it doesn't matter. For an older child, it does matter. So keeping the environment warm, welcoming, and as child friendly is definitely a step forward to helping the child in accepting it. Then of course I spend my time with the parents, helping them understand, accepting it, helping whatever family counseling we help making them understand how early intervention or therapy can help.
But this is when someone comes to your center. Now, my question is, because there is shame and guilt attached to therapy, uh, parents are not ready to accept, right? So how do we shift that mindset that occupational therapy is not only for special kids, it is for neurotypical kids also if they're going through certain sensory issues?
When we started to today, people are much more accepting, people are much more outspoken about them, because there are so many kids around you. If you say 1 in every 7, that means in your friend group there is definitely 1 or 2 of your friends. You go into a space, you then start seeing, or the more the people talk about it, saying that we and share their happy experiences with their friends and family, will you will make some other child benefit from your experience.
But you said this couple of times, 1 in every 7 kids go through this. Why is this happening? This statistics is very alarming. Is there a particular reason for it?
So there's not one particular reason. There are many reasons. Like I said, we all have children later today. We do have a lot more IVF children coming into this world. Not that IVF does define, but basically having children later. Of course, we had COVID, which was not a natural situation. So the natural development of the child did get hampered. Of course, the number of preservatives, the food, the pollution, the environment we are bringing our children up in is, and of course, stress.
Yeah.
Let's talk about stress, which is a real thing. Stress in marriages, stress in work, stress on ourselves, the amount of stress we put on ourselves in every way, right? I mean, that does play some part of havoc in this. And it's okay, like I said, we have to be thankful that if even if it is on the increase, it's okay. It's a very manageable problem. It's not like something that like I said, you have a traffic jam, you make a highway, we have a C-link, and we've done it for solving the problem, right? We didn't stop development for the reason that the roads are getting too congested. So I can't tell you or myself or this generation that let's go back to the way our grandparents lived, because that's not realistic. But if for some reason we do need help, then we can always take it.
That's very, very beautifully explained. Now, coming to mother's instinct, and I guess this is a perfect last question which I'm going to ask you. Somewhere a mother knows that there is something wrong, but एक डर रहता है बोलने के लिए, because it's almost like if I say it out aloud, it's going to come true. What would you tell mothers who know that this is not bad behavior, this is aggression, this is not a fussy eater, this is a sensory issue, this is not a struggle with attention span, it's something more, but they are just afraid to say it out aloud?
So you don't need to say it out aloud. Like, try and seek help. Go and understand. Go question your therapist. Go and ask as many questions as you need. Feel comfortable in the environment before understanding that your child might need it. And once you're comforted, and my request is accepted. And if, like I said, if you can take them to a gymnastics class, it's not the end of the world to go to a occupational therapy center. Yeah, the benefits are going to be longer lasting and much more fruitful.
So it's awareness, acceptance, and then eventually act upon it.
Yes.
That's amazing. And Anisha, I've loved our conversation. Before this podcast, I was one of those people who thought that OT is for special kids. But during the research and after this conversation, I guess I've changed my outlook. And I hope conversations like this help create awareness for betterment of the kids out there. And thank you so much for joining us and giving us time today.
Thank you.
Thank you.